mistake, just one mistake can change a baby's life forever. Let me repeat that. One mistake can change your baby's life forever. And as a midwife, one of the heartbreaking things I've come across is when mother is asking me, can my baby be ever normal again? Would I not have to be carrying the burden of this baby for life for something that can be prevented earlier? We are going to be talking about major causes of brain damage in baby. Okay, so if you know of anybody that will benefit from this video, whether single, whether married, please share it to them. Make sure you save this video also. Now, most women, when we talk about brain damage, they will think it's during delivery or during childbirth that they got it. But no, brain damage to baby can be gotten before delivery, during childbirth, and even after delivery. And that is what we are going to be talking about in this video. The first major cause is lack of oxygen during labor. During labor, your baby's brain needs a constant supply of oxygen, as in constantly. And issues like, cord compression, placenta insufficiency can cause, or fetal distress can cause reduced oxygen supply to your baby's brain. And that is where one of the problem comes from, which is why you see us monitoring you during labor back to back, checking that fetal heart rate, making sure that your baby's oxygen. When we see that the baby is having fetal distress, we start telling you that we need to bring baby out immediately. There is a reason for that, because we don't want baby to suffer permanent brain damage. Second one is severe newborn jaundice. Many families have at least seen a baby with jaundice, because a hole is very common. It is common. Most people now think it is not serious, but it is very serious. Jaundice causes build up of bilirubin. So when build up of your baby is now severe, what happens is that there is bilirubin build up in the brain. Build up of bilirubin in the brain causes a permanent brain injury known as kernicterus. Okay, so that is why if you see your baby is getting yellowish, your baby is refusing feed, your baby is doing this, and you are thinking it's jaundice, don't think. Okay, act on your instincts. Don't think alone, act on your instinct. Take baby to the hospital. Jaundice is treatable, okay, before it gets severe. The more severe it gets, the more harder it is to control. The major thing that can cause brain damage in your newborn is severe infection or sepsis. Okay, as we all know, newborn immune system, they don't have fully developed immune system, so infection can spread very fast, and it can spread to the brain, okay, where it will cause a lot of damage. So if you see that your baby is showing signs of infection, please, it is very important to act fast before it overspread. Another important cause is low blood sugar. See, the brain relies almost entirely on glucose for feeding. So when baby is having low blood sugar for long, is going to cause brain damage, okay, which is why sometimes you see that these things happen most time in premature babies, babies that are finding it difficult to feed and latch. That is why you see we start shouting, feed your baby immediately after delivery. Even if you deliver through cesarean section, we start looking for formulas to feed your baby. Finally, we have head injuries. Okay, babies suffer head injuries from carrying, falling, shaking. Sometimes when they are crying, I know caring for baby is exhausting, but sometimes when they are crying, you see, will be shaking babies. From there, they can suffer brain injuries. So no matter how overwhelmed you are feeling, please resist the temptation to shake a baby. Okay, the thing is that most of these causes, they are actually preventable. Yes, they are preventable. So just make sure during pregnancy you attend your antenatal, you do all these things that they said you should do, and you will be fine. Sometimes one quick decision can protect your baby's life for the rest of their life. All the best. Bye.